Hi everyone. Today in this video, let us discuss about the Naproxen. Naproxen is one of the NSAID non-steroidal anti-inflammatory drug, and this drug belongs to the aryl propanoic acid derivative. We can observe the structure like this, and this is the Naproxen. Within the name, we can observe the infix pro. The pro indicates a propanoic acid derivative. And here in the structure, you can observe the carboxylic acid attached with a 3-carbon chain. So it is a propanoic acid derivative. And at the second position, it is having a naphthyl ring system. So now if we write the IUPAC name of the Naproxen, the suffix is the propanoic acid. Second position is having a side chain. So 2-. What is the name of this side chain? The side chain is the naphthyl ring, which is having a methoxy group at the 6th position. So this is the 6-methoxy naphthalene 2-ide. So simply Naproxen is the 6-methoxy naphthalene 2-ide propanoic acid, that is nothing but the Naproxen. So it is a aryl propanoic acid derivative. Now let us see how this Naproxen acts as analgesic, anti-inflammatory and as well as antipyretic agent. So within the cell, the nuclear membrane is composed of phospholipids. These phospholipids are going to be cleaved by one of the enzyme phospholipase A2. Now this phospholipase A2 will cleave this nuclear membrane such that it is going to release one of the important mediator, that is the arachidonic acid. This arachidonic acid is a C20 fatty acid which is responsible for the generation of so many types of mediators. It can produce the prostanoids like the prostaglandins and thromboxanes. Otherwise it can produce the leukotrienes, and it can also produce the other lipoxins. But here, one of the important pathways is the COX pathway. This arachidonic acid is converted into two important prostaglandins, PGG2 and PGH2, which are the cyclic endoperoxides. These cyclic endoperoxides are going to convert into other prostaglandins and thromboxanes by cleavage of this peroxide bridge. Then they are going to produce the prostaglandins as well as the thromboxane A2. And here, these two steps are mediated by one of the enzyme, COX enzyme, cyclooxygenase enzyme. Cyclooxygenase enzyme converts the arachidonic acid into the cyclic endoperoxides like the PGG2 and PGH2, as well as further conversion into the prostaglandins and thromboxane A2 is again mediated by COX enzyme. This COX enzyme is having the oxidase activity as well as peroxidase activity, by which it can produce the prostaglandins and thromboxane A2 from the arachidonic acid. Now here, what is the role of these prostaglandins? We have the different types of prostaglandins like the prostaglandin D2, E2, I2 and F2. So all these prostaglandins are having the various roles on the physiological system. Here we can observe the three important pathological roles of the prostaglandins. These prostaglandins are going to increase the nociception, which will increase the pain sensation, and it can also increase the fever. Hyperthermia is going to produce by prostaglandins, and inflammation is again increased by prostaglandins. And apart from these three pathological roles, the prostaglandins are also having few of the beneficial effects. Particularly prostaglandin E2 and I2 are going to control the gastric acid secretion from the gastric parietal cells, and they also increase the glomerular filtration. In this way, prostaglandins produce the variable effects, and they can also decrease the platelet activity. On the other hand, the other mediator is the thromboxane A2, which is going to increase the platelet activity. In this way, COX pathway can produce the mediators which produce the variable effects on the physiological systems. But here the three important pathological actions are the nociception, fever and inflammation, mainly produced by prostaglandins. So here the Naproxen is one of the non-steroidal anti-inflammatory drug which is going to inhibit the COX enzyme. Thereby it inhibits the synthesis of the prostaglandins as well as the thromboxane A2. Now what are the pharmacological actions of the Naproxen? Already we have seen that the Naproxen is going to reduce the pain as well as inflammation and body temperature. All these are going to be reduced, which results in the therapeutic actions of the Naproxen. That's why this drug is useful in the few of the conditions which includes the pain at the joints, for example osteoarthritis. Similarly, rheumatoid arthritis, which is again associated with the inflammation, and in the treatment of acute gout, spondylitis, other nociceptive conditions, Naproxen can be used. And Naproxen can also be used in the treatment of migraine along with the other drugs in order to control the severe headache produced in the migraine. So these are the few of the beneficial actions by inhibition of the pain, inflammation and body temperature. But apart from this Naproxen can also produce few of the unwanted effects because of the protective action of the prostaglandins on few of the physiological systems. So now let us see the action of the Naproxen on the GIT. Already we have seen that naproxen is going to inhibit the prostaglandins, but the two important prostaglandins are the prostaglandin E2 and I2. These two prostaglandins are going to control the gastric acid secretion from the gastric parietal cells, and along with the bicarbonate, they are always controlling the gastric acid levels within the stomach. Now, when the sins of these prostaglandins are going to be inhibited, it results in the increased gastric acid secretion. And when the gastric acid is excessively secreted, it results in the dyspepsia, which may produce the gastric irritation, gastric pain, and even gastric ulcers. And naproxen can also inhibit the platelet activity, thereby it can increase the hemorrhage. So here naproxen can produce the gastric bleeding by increasing the gastric secretion as well as by decreasing the platelet activity. So dyspepsia and gastric bleeding are the two important unwanted effects of the naproxen. And this side effect is observed with all of these NSAIDs, which are non-selective for the COX enzyme. That means they are inhibiting the both COX1 as well as COX2 enzymes. But we have the selective COX inhibitors like the celecoxib, which are going to inhibit the COX2 enzyme, so that they are not inhibiting the prostaglandin synthesis at the gastric parietal cells. But here the naproxen is non-selective. It can increase the gastric irritation, dyspepsia, gastric ulceration, and even the gastric bleeding. Second one is the action on the kidney. This is again very important, and many of the NSAIDs again show some adverse effects on the kidney. So again, the prostaglandin I2, which is commonly known as prostacyclin, which acts as a vasodilator, and this prostacyclin is also responsible for the inhibition of the platelet activity. Now this prostaglandin I2 is responsible for the vasodilatation of the afferent arterioles at the Bowman's capsule. Afferent arterioles are the incoming arterioles which are going to entering into the Bowman's capsule. So when these afferent arterioles are going to be dilated, they can supply a large amounts of the blood such that it is going to be filtrated. So the afferent arterial vasodilatation results in the increased glomerular filtration rate. In this way, prostaglandin I2 is required for the maintaining the glomerular filtration. Now here again, the NSAIDs like the naproxen, when they are used for a longer period, they can inhibit the prostaglandin I2 synthesis. Thereby they inhibit the afferent arteriolar vasodilatation, which on long term results in the decreased glomerular filtration rate. So as the glomerular filtration is going to be reduced, it results in the decreased renal functionality, which finally results in the increased renal failure. So when the naproxen is used for a very longer period, it can produce a renal dysfunction, which may result in the risk of the renal failure. And particularly this risk is going to be increased when this naproxen is given along with the other drugs, which again produce the renal failure. Next, let's say other actions. Naproxen is going to decrease the platelet activity. Already we have seen that naproxen is going to inhibit the prostaglandin synthesis, as well as it's also having some inhibitory effect on the thromboxane A2. Even it is not the major action, but it is a little inhibitory action on the thromboxane A2. Thereby it inhibits the platelet activity. And when the platelets are not aggregated, it results in the decreased clotting. So this results in the hemorrhage in the patients. Again, the risk of hemorrhage will be increased when the naproxen is given with the other drugs, which increase the risk of the bleeding. Similarly, another one is a decreased COX pathway. We have seen that arachidonic acid is responsible for the generation of so many types of mediators, and among them COX pathway is the important pathway which is responsible for the generation of the prostaglandins as well as the thromboxane A2. But when this pathway is going to be inhibited, other pathways are going to be more stimulated, results in the production of the other mediators like the leukotrienes. So this is just like the aspirin. Naproxen can also inhibit the COX pathway, thereby it can increase the leukotriene production to a little more level, such that it can produce few of the bronchoconstrictory effects as well as flu-like syndromes. In this way, along with the beneficial effects, naproxen also produces few of the unwanted effects. What are the side effects? So now we have seen few of the pharmacological actions which result in few of the side effects. So headache is one of the important side effects that is observed with the naproxen, and dyspepsia, constipation, gastric bleeding are few of the gastrointestinal side effects observed with the naproxen. Similarly, it can produce anemia, loss of hemoglobin, and it can also produce flu-like syndromes by increased production of the leukotrienes and other mediators. And naproxen can also produce edema and dyspnea, loss of difficulty in breathing. Both of these can increase the risk of coronary disorders as well as the stroke in the patients. And naproxen can also produce the few of the infections like the pharyngitis and bronchitis. These are particularly increase the allergic response mediated by few of the inflammatory mediators. What are the contraindications? Hypersensitivity is one of the contraindication, and another one is the asthma, because we have seen that naproxen can produce a bronchitis as well as some of the inflammatory conditions because of production of the leukotrienes and other mediators. So the risk of asthma and other respiratory disorders may be increased with the naproxen, so it should be carefully given in the asthmatic patients. And coronary artery bypass graft, this is very important. In the coronary artery bypass graft, if naproxen is given, it can decrease the coronary blood supply and it can increase the risk of the stroke. That's why in this condition, naproxen is strictly contraindicated. Drug interactions. One of the important side effects of the naproxen is the renal failure. So we know a few of the drugs like the ACE inhibitors, which are ending with the suffix pril, like the captopril, enalapril, lisinopril. All these type of drugs are ACE inhibitors. Similarly, ARBs, angiotensin receptor blockers, like the losartan, valsartan, candesartan, and many other drugs which are ending with the sartan. These two category of drugs are going to produce a common side effect because they are going to decrease the renal functionality. They can produce the renal failure. ACE inhibitors and ARBs can produce the renal failure. So when the naproxen is given along with these drugs, it can increase the further risk of the renal failure. So naproxen shows a drug interaction with the ACE inhibitors and ARBs in producing the renal failure. And another one is a digoxin. Because naproxen is going to produce the renal failure, it can decrease the excretion of the digoxin, which results in the elevated levels of the digoxin in the plasma, leading to digoxin toxicity. So whenever the digoxin is given along with the naproxen for longer periods, the dosage adjustment should be done in order to prevent the digoxin toxicity. Similarly, diuretics like the furosemide and hydrochlorothiazide are mainly acting on the renal tubules, but when the naproxen is given for a longer period, it decreases the renal functionality, which results in the loss of activity of these diuretics. So when these diuretics given along with the naproxen, the diuretic activity is somewhat lost because of the renal failure. And finally, the few other drugs which are going to increase the risk of hemorrhage, like the anticoagulants like warfarin, and a few of the NSAIDs like the aspirin and SSRIs, all these type of drugs can increase the risk of the bleeding. So when these drugs given along with the naproxen, they can increase the hemorrhage and a severe bleeding can be observed in the patients. So these drugs should be carefully given along with the naproxen. How it is given? Naproxen is given as a tablet or capsule at different doses like 220, 250, 275 mg as well as 500 and 550 mg. And it's also available as a extended release tablet at the different doses like 375 mg, 500 and 750 mg. Otherwise, it can be given as a suspension at a dose of 250 mg per 5 ml. So that's about the naproxen. Naproxen is a aryl propanoic acid derivative and it's a non-steroidal anti-inflammatory drug. This drug inhibits the COX enzyme, thereby it inhibits the prostaglandin synthesis, which results in the decreased nausea, fever and inflammatory conditions. But at the same time, it increases the gastric acid secretion, resulting in the dyspepsia, gastric irritation and gastric bleeding. And it also decreases the renal functionality, which results in the renal failure on long-term treatment. Particularly, this drug can increase the risk of coronary disorders and it may increase the stroke in the patient. So it should be carefully given in the coronary artery bypass graft. So that's about the naproxen. Hope you have enjoyed this video. If you like this video, please subscribe to our channel. Share this video with your friends. Post your comments in the comment box. Thank you for watching this video.